You're listening to Where Before Meets After. What's on the horizon?
There is one other thing on the horizon, I think, for body contouring, and that is sort of the next level. And if we kind of think about this, skin, we've been removing it. Fat, we've been liposuctioning it. Now we've been giving it back. Muscles, we've been figuring out ways to augment it, either by adding a little bit of fat in or putting implants in. And so the next portion in trying to body balance is actually the bones. And there have been some developments or there's been some work, again, mainly out of South America and Central America, of seeing can you safely, and that's the key word, reposition or basically control break people's ribs to reshape them. And I'd say it's ongoing. I don't think you could give it the thumbs up that it's fully been vetted 100%. I'd say it's been looked at pretty heavily for the past, 2 years, 3 years. Yeah. And again, you got some people willing to pioneer in that space, and you've got people willing to be tested on in that space.
This is a revisiting of an older idea where people would actually remove lower ribs, the entire lower rib, which is a radical procedure and not a benign procedure.
That was the main issue, is that there was severe consequences because you could frequently get into lungs, except like your ribs have very important structures behind them. I mean, obviously, but that was the issue with it.
Yeah. As plastic surgeons, we do procedures with great frequency and skill, but we also are very well trained as surgeons to know what lies on the other side of where we're working. You're doing a breast augmentation, you're doing a capsulectomy, you got to know not how to get into the chest, things like that. We're very trained for this, and we know what to do if things happen as well.
Where is that headed? Where are we going with the rib thing?
I don't know. I have been going to the talks throughout the world, and it is seeming that as the individuals are doing them more and more, it's becoming a more reproducible and safer procedure. But love to hear Mark's opinions too. But there is that point where you say, like, well, each time we push that envelope and we start doing on bigger and bigger changes, the negative to that is there's just bigger and bigger possibilities for complications that are much more grave. And I think that's kind of where we're at right now. I think that's sort of the general consensus of this is just, hey, wait a minute. Like, I get it. You've gotten it now to a point that's reproducible and seems to be relatively safe, right? Based on current data.
Yeah, it's risk and benefit. And you have to see how you can do it in a safe manner that you can teach to other surgeons who can reliably do it safely. If you just have a handful of surgeons who do it well and do it safely, and other people are doing it and getting into trouble, then it's not a good operation.
I'd like to piggyback off that because I think the other issue/concern is there appears to be a learning curve with it, right? Like anything in life, there's learning curves, anything we do. The question is just, what are the negative complications during that learning curve? I think that's really where we're at right now with the rib sort of remodeling, sort of restructuring, is just how are we going to be able to get people to learn and educate in a way that we can avoid these major complications during the learning curve. What would you say that's fair, Mark?
Yeah, definitely. Absolutely.
All right. Give me your Instagram, your website, and where to find you.
EpsteinPlasticSurgery.com. And our Instagram is dr.mark, M-A-R-K, Epstein. You can find me on Long Island in Hauppauge. It's in Suffolk County.
And I am a SoCal plastic surgeon, Matt Nykiel, in Newport Beach.
Thanks for listening. I'm your host, Eva Shea. Follow the show and submit questions for our experts at wherebeforemeetsafter.com. Where Before Meets After is a production of The Axis.